If you're dealing with knee osteoarthritis and you're in that phase where you can begin shifting stress away from the joint and into the muscle to begin spread force more broadly around the leg and away from the knee joint, then one of the most important things you need to learn how to do is to modify the exercise to ensure that it is pain-free. Okay, and actually feel the muscles working and not the joint. Okay, so let's take this, what we call a chair squat hover, as an example, where we're trying to actually send that stress from the joint into the muscles, into these muscles here. So let's say, for example, I set up, I grab onto something in front, I hinge forward, I build pressure into the ground, and I hover on my hips from the chair, and I hold for a couple of seconds. I want to be feeling load through here, and that sensation of muscle working here, not necessarily in the joints. But if I feel it all in around the joint, then instead of just saying, I can't do that exercise, first modify and tweak the exercise. So sometimes it can be as simple as adding something underneath your hips to change the knee angle, the initial knee angle where your hips are now slightly higher than the knees. Then all of a sudden you get into that position, you build pressure down, and now it feels much better in the joint, and you start to feel that pressure coming up into the muscle. Okay. Now, you might have to add more blocks or more surface elevation underneath your hips. But one of the key things to understand there is that oftentimes in the presence of cartilage loss, which is what happens in knee osteoarthritis, certain levels of knee flexion can irritate different parts of the joint. So for example, in this position here, you may have a lot of irritation in between the kneecap and the thigh bone, or between the thigh bone and the shin bone, and just slightly modifying it where the hips come a slight bit higher may take that irritation off that area and allow you to actually begin loading the muscles and allow the muscles to take that stress off the knee joint. Okay, that is one of the biggest things that is limiting people, is that they're struggling to find ways to not load and irritate the area that is already irritated, and allow them to experience stress and load into the muscles, which you need to do because with a loss of cartilage, you've lost some of that shock absorption. So you need to begin shifting stress away from the joint and into the muscle, because the muscle, essentially, you want to think of the muscle as your armor. You want to build better muscle armor around the leg. And you can only do that if you're prepared to modify things, instead of thinking, for example, oh, I tried squats, or a squat like this, it hurt my knees. Well, did you try to modify and tweak things first before you just avoided exercise? And it's the avoidance of the exercises then that actually perpetuates the pain and perpetuates the progression of osteoarthritis.